Good afternoon, everybody. Today is Wednesday, December the 16th, 2020, and I want to be updating you on COVID-19. So Canada has 47,009,720 cases in Canada confirmed today. So Alberta has 83,327 cases, 744 deaths. British Columbia has 43,463 cases, 668 deaths. Manitoba has 21,826 cases, 523 deaths. New Brunswick has 567 cases, 8 deaths. Newfoundland and Labrador has 364 cases, 4 deaths. Nova Scotia has 1,430 cases, 65 deaths. Ontario has 14,006,535 cases, 4,035 deaths. Prince Edward Island has 89 cases, 0 deaths. Quebec has 16,009,173 cases, 7,613 deaths. Saskatchewan has 12,594 cases, 98 deaths. Northwest Territories has 22 cases, 0 deaths. Nunavut has 258 cases, 0 deaths. Yukon has 59 cases and 1 death total. Daily death cases. So, reported on the 15th of December, Canada has 0 death total, Alberta has 0 death total, BC has 0 death total, Manitoba has 0 death total, New Brunswick has 0 death total, Newfoundland and Labrador has 0 death total, Nova Scotia has 0 death total, Ontario has 0 death total, PEI has 0 death total, Quebec has 0 death total, Saskatchewan has 0 death total, Northwest Territories has 0 death total, and Nunavut has 0 death total. Daily deaths. Canada has 0 daily deaths. Nationally, zero daily deaths. Alberta has 0. BC has 0. Manitoba has 0. New Brunswick has 0. Newfoundland and Labrador has 0. Nova Scotia has 0. Ontario has 0. PEI has 0. Quebec has 0. Saskatchewan has 0. And the Northwest Territory has 0. So these are the cases that we have in Canada and all that. Today, I want to be announcing about the new restrictions that will be put in effect for our school, and I'll be announcing those new restrictions right away before I move on to other things. So first of all, the new restrictions will require that mask will be mandatory in my school. Everybody will have to be wearing mask, and it's the law now that mask has to be put on and has to be everywhere, regardless where you are and or where you're from. You have to wear that mask, or the mask you have to wear it. So mask will be one of the things that I expect people to do and to follow the health rules and follow the health guidelines. So mask will be part of the restrictions. Also, the restrictions will include that you're forced to bring your own hand sanitizers, your own cleaning stuff. You're gonna also include the restrictions. It will include also to bring your own devices, your own computers, your own uh, laptops. So those are restrictions. Some of these restrictions are going to take effect now, and some of them they will be taking effect in when we go back to regular life and back to regular schooling. So some of these restrictions are going to be in effect starting today, and some of them they're going to be still in effect when we start school, right? So those restrictions I already said. The first restriction, it will be mask. It will be all mandatory. Everybody will be wearing mask, and by law you have to wear mask. The second restrictions is you're gonna have to bring your own hand sanitizers and your own devices. If we use devices for our classes, it's very important that you bring your own devices, um, um, your own things. Also, vaccines will be mandatory for my school, including students that are going to be coming to my school. You're going to have to get a shot and you're going to have vaccine because vaccines now are mandatory everywhere. So they will be mandatory also in the school. So it's a must now. When we open the school, hopefully, I'm thinking by March 2021, I already predicted by March by March, I will be opening the school, March 20th, 2021. And there will be only 5 students that are going to be allowed to come to class. I'm not allowing more than 5 students to enter the school. The remainder of the students are going to be online. Whoever comes first comes first. Whoever doesn't show up on time will not be able to come to the school. So if you really want to come to the school and you want to be one of the early people to come, then you have to show up on time. If you come up late, um, the door will be locked, so you won't be able to come to the school. So that's hopefully that makes clear to what I'm talking about, because it's really important that will happen. And I'm saying that so that will be something that will be happening starting March 20th, right? And it's very important you bring your own devices. I'm not preventing supplies and anything that has to do with supplies or computers or anything that has to do. It's very important that you guys have to make sure that you bring your own devices, you bring your own supplies, because I'm not providing any supplies, I'm not providing anything. So it's your responsibility to make sure that you bring these things on your own. So hopefully what I'm talking about really makes sense, because I can repeat it again if you want, but those restrictions are going to be taking place. The restrictions that are going to be taking place starting today are the restrictions that has to be your camera always have to be on when I'm teaching in class, and also um, you have to be here every day on time. That's what's really important. But the restrictions that are going to be taking in March are mask rules have to be applied during class time, and also the restrictions will be the other restriction that will be taking effect is you're going to have to bring your own devices, your own supplies, your own hand sanitizers. I'm not providing anything, right? Until life goes to really full normal, and that will be by June. But by open in March, things are not going to be that great, and vaccines will be mandatory to take. So if you're planning to come to school and you want to be, because some people they hate going online and they don't think online is that great. So vaccines will be a mandatory to take if you're gonna come to school. So just know that you're gonna have to take it, and you're gonna be forced to. If you do not want to take it, then you can continue being online until life goes back to normal and things can be back the way it is. But if you don't see the safe and you wanna come to the school, then you're gonna have to first force to take that vaccine. So it's your choice, because some people they don't want to take vaccine at all, and some people they don't see it safe. So if you don't want to take it, then you have a choice just to continue doing online, and maybe that's safer for you, and you continue that route. So those are the restrictions that are also going to be taking effect, right? So until it's safe, that's how things are going to operate for the school. And also, I'm going to allow 5 people to come to the school. I'm not allowing more than 5. And when the numbers get slowly better, then I'm going to start allow 10, then I'm going to allow 15, then I'm going to allow 20. And that's how it is. It will take time, because these numbers are going to take time to go down. So I'm going to take my time too, until I will start increasing the numbers when I see the numbers are going down and down and down. But I'm not going to increase the numbers if still the numbers are really high in Alberta. So that's the question. That's the plan, and that's the result at the end of the day, and that's my plan to do, right. So the restrictions are going to be in effect today. Our restrictions has to do with the camera. It has to do with making sure that uh, you're not turning off your camera and leaving. You have to make sure that you're here every day. So these are restrictions. There's only one restriction I put in place for now, because I can't really do much restrictions when I don't even see you. But these are restrictions are going to be in place, right? And if you borrowed any computers or anything from the school, make sure that you return it by end of the semester. And this end of the semester it will be in January. So in January, um, make sure that you return whatever devices you use, whatever anything that you use. You make sure that you make that time to return those devices. So hopefully what I'm talking about really makes sense, because it's not waste of a time. This is the restrictions that are going to be put in place today, and there's going to be majority of the restrictions are going to be put in place in March, because March is when I'm starting to open the school, and that's already decision I made. It will be March 20th, 2021. That's the day I'm going to be opening the school, and that's the day those restrictions are going to be applied, and there either maybe more, maybe there will be maybe more restrictions if people don't follow the rules, right? We will see when the school opens how these restrictions go. But if I see there's a problems and people are not following those restrictions, then we might have to start going back to a lockdown for the school, and we're gonna go back to full online again, because um, the reason I'm opening March, because I understand a lot of people are tired from online and they need change and they need to go back, right? Although the government of Alberta already announced that a school's supposed to be open in January, but I'm gonna take 2 months later and open it in March, because by then things should be a little bit better, maybe not 100%, but it will take time. So we will see in those a couple of weeks and a couple of months how things are going to be, but those restrictions are going to be in place, and they're going to be, only one is going to be in place today, and the rest it will be in place in March. Okay, and those are like 5 restrictions I put in place now. And if people don't follow those, then there will be more that are going to be added if people don't follow the rules and you don't follow the health rules. So hopefully, if you have any questions about the restrictions, I'm willing to answer those questions about anything that has to do with the restrictions that I talked about today. Now I'm going to be talking about the vaccine, Pfizer. We already have this week vaccine Pfizer that already came, right? A lot of doses and a lot of vaccines that already came, right? So what's really important that it's very important that Moderna is coming next week too. So we have 2 vaccines that already came. One already, Pfizer just came this week, came on Tuesday, and Pfizer and Moderna is going to be coming sometime next week. So we're going to have 2 vaccines that are already coming very close, and both are in December. And before that, we were thinking vaccine will be coming like in March, or it will be coming later, maybe in February. That's what we were assuming before, but we're lucky that the vaccine came right away, because by January we will not know how things would be, how life will be by that time. We will not know, right? So it's a good thing that the vaccine came right away before it's too late for it to come, right? So we should take the opportunity and making sure that we take it very seriously and not joke around with those kind of stuff, because at the end of the day, our health was is what really is important. We need to follow the health guidelines. We need to follow the health rules, like I said yesterday, right? And it's that simple. If you follow the health rules, you're safe, right? And the vaccine is your choice, right? But I'm saying when it comes to the school rules, the vaccine will be a must for the people who are going to come to the school. You're not allowed just to go and not have the vaccine. You're gonna be accountable. You're gonna have to take it, so you won't have a choice. So that's just something, just to let everybody know that the vaccine, it will be something that you're gonna have to do it, and you're gonna have to take it if you plan to come to the school. And if also you plan to come to the school, you have to be one of the early students to come. If it has to be, I'm just allowing 5 students to come. I'm not allowing more than 5 students to come. So if you are only that much, you're gonna be coming. So it's how much you take it, how much responsibility you take it, and that's what really matters, right? So this today's restrictions is something for us to learn from, and making sure that we take it very seriously in any way. I'm willing to answer any questions that you have about the restrictions, and I'm willing to do that. So if you have any questions that about has to do with restrictions, I'm willing to answer them, and there's nothing wrong with that. If there's a question that I did not answer or I did not get to yet, I'm willing to answer those. But these restrictions are going to be in place starting today, and some of them are going to be in place on March 20th, 2021. So it's very important that people take it that seriously. Now I'm going to be talking about Alberta, although nobody has questions to answer. So I'm going to be moving on talking about Alberta's numbers, and talk about those numbers, and talk to you guys about how important these numbers are in Alberta, right? Um, so we will be moving on talking about Alberta. So So our premier talked yesterday, and he said, I'm going to be reading the article, that the latest, the province will send COVID-19 care team to the 11 worst hit communities, 9 in Edmonton and 2 in Calgary. They'll deliver care packages, provide information in multiple languages, and arrange on the ground support and safe transportation to COVID 19 assessment faculties. The province has set up 16 self isolation hotels that will provide a free stay and food for 14 days. Six in Calgary, nine in Edmonton, and one in Peace River. The Calgary hotel has capacity of 791 people, and in the Edmonton hotel can accommodate more than 1,300. Premier Jason Kenney said on Tuesday those who self-isolate at the hotels will be eligible for temporary financial aid in amount of $6.25 at the end of their stay. So that's what he announced yesterday. The province will receive 3,900 doses of biotech vaccine on December 14, expects to get another 25,350 doses at the start of next week, officials say. So we're going to get 25,000 doses by end of next week, and that will be good to see that amount of vaccines that are going to be coming in Canada, right? Um, Alberta reported 1,341 new cases on Tuesday, bringing the province total to 20,649 active cases with a positive rate of 8.2%. 11 more people have died for a total of 744 deaths. There are 742 people in hospital and 137 in ICU. The R the R value of reproduction number over the past 7 days averaged 0.98. Value of 1 means the affection person has infected an average one other person. If the value is above 1, the spread will continue to grow. Sweeping new restrictions intended to curb the surge of COVID-19 in the province took effect on December 13. They will remain in place at least for 4 weeks through Christmas and New Year's. So those are the restrictions, and already the premier announced that um, that will happen, right? Um, So here is the regional breakdown of active cases reported on Tuesday. Calgary zone has 7,331, down from 7,379 reported on Monday. 25,097 recovered. Edmonton zone has 9,946, down from 10,194. 25,288 recovered. North Zone has 1,250, down from 1,287. 4,232 recovered. South Zone has 553, down from 5,803. 3,989 recovered. Central Zone has 1,496, down from 1,594. 3,189 recovered. Unknown has 73, down from 8,600. 139 recovered. Here is the other things that are going on across the provinces. I already read this yesterday, but we will move on to today's news. If there's any news that has to do with COVID or anything. Oh yes, for my class, make sure that on Friday there will be a unit exam for the unit 2 of the English. So make sure for English 30-2. So make sure that you get that done by Friday. Friday there will be the unit exam. So make sure you're here on time so I can give you the unit exam by that time. Now I'll be moving on talking about politics and how things are, right? So Canada can expect to have enough doses on hand next year to vaccinate every Canadian that wants a shot by the end of September, according to the Public Health Agency of Canada. The statement comes in confusion over competing information released to reporters last week about vaccination timelines. Some federal documents distributed at a COVID-19 brief last Wednesday suggest that inoculation campaign would be completely by the end of 2021, while other material pointed to more optimistic September date. Prime Minister Justin Trudeau himself has floated September 2021 as a date when a majority of Canadians might be gone. Doctor Howard Nijo, Canada's Deputy Chief Public Health Officer, has offered a different estimate, saying that the end of December 2021 would be more likely. The the pharmacy now says it believes Canada's vaccine supply will be significant to allow all Canadians wishing to be vaccinated to get their shots by the end of September. Based on the current data, by the end of Q3 2021, Canada projects having a significant number of doses to be to be able to offer a vaccination to every Canadian. A spokesperson for pharmacy said in a statement uh, to the Q3 refers that the third quarter of the calendar year, July, August, and September, Canada has signed purchases agreement with 7 different pharmaceutical companies for up to 418 million doses of various shots under development, an insurance policy against the possibility that some of the vaccines in development prove to be ineffective in clinical trials. Some supplies could also be donated to developing countries. The September date is premised on all of the companies with which Canada has signed purchases agreement. Pfizer, Moderna, uh, Medicago, Astra, Johnson and Johnson, and Vovax, securing regulatory approval and meeting planned timelines for the delivery of doses, the pharmacy's spokesperson said. It's important to underscore that timelines for delivery of doses vary across the vaccine candidate and are dependent on companies' ability to scale up manufacturing, clinical trial timelines, result, and sequence regulatory filling, the spokesperson said. Monitoring access to supply is one of the key elements that will contribute to Canada's overall plan. And with this in mind, our stated goal of providing enough vaccine for all Canadians in 2021 is still accurate. The Pfizer product was approved last week for use in Canada, and the federal regulators are now reviewing applications for Moderna and Johnson and Johnson pharmaceutical divisions. The province began vaccinating some healthcare workers and long-term care homes residents with the Pfizer vaccine this week. Trudeau announced Tuesday that 16,800 doses of the Moderna shots are expected to be available in Canada months by end of the month. Sorry. But with just a few thousand doses delivered to this point, Fortinet conceded there could still be hip hiccups as hundreds of thousands of doses come online in weeks to come. The provinces and territories have agreed to largely follow vaccination guidelines released by the National Advisory Committee. Long-term care and retirement homes, residents and staff, and the elderly, frontline healthcare workers, and some Indigenous adults will receive shots in the first phase of distribution. The vaccination campaign for general population will begin in April. While Canada has ordered more than enough doses to vaccinate everyone who lives here, early polling suggests a sizable minority, 13% of all people surveyed in recent Angus Reid Institute poll, will not take the shot at all. The World Health Organization estimates that at least 65 to 70% of given population must be vaccinated to develop some degree of herd immunity and halt the spread of the disease. Once that threshold reached, the COVID-19 virus will have fewer possibility human hosts driving down transmission rates. Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Disease, has said the US could begin to achieve herd immunity by late spring or summer. I would say 50% would have to get vaccinated before you start to see an impact, Fauci said in an interview with the National Public Radio on Tuesday. But I would say 75 to 85% would have to get vaccinated if you want to have that blanket of herd immunity. So these are the news that's happening about the vaccines, right? And what's happening with the CERB, right? Of 44 million 1,000 Canadians sent education letter for Kura about possibility CERB repayments. Employment Minister Kara said Tuesday she feels bad for Canadians who applied for the Canada Emergency Response Benefit, thinking that they met the minimum income requirement only to learn they might now have to repay thousands of dollars. But while the minister told nothing is off the table, the government is not considering letting everyone who applied in good faith off the hook, as the NDP and the Green Party have suggested. There is not a conversation happening right now where we would forgive people, where we would not require people who were not eligible to pay it back. No, she said. In recent weeks, some 44 million 1,000 Canadians have received education letters from the Canada Revenue Agency asking for more information to determine whether they met the income eligibility critical for the CERB repayments they received. Many who face the prospect of repayments have argued the government has not been clear about how it defines income. The CERB application asks Canadians to attest that they made a minimum of $5,000 before taxes in the last 12 months or in 2019. Some self-employed Canadians say they believe that meant all income, since there was no mention of expenses. The the Cura insists self-employment income always refuses to net pre-tax income or gross income minus expenses. For a self-employed person, those expenses could include the cost of materials needed to run their business or work-related cell phone bills. Others point out that the Canada Emergency Response Benefit Act itself only refers to a total income. I had thought myself I had been pretty clear in my communication, she said, but obviously if people misunderstood, that's on us. It's up to us to communicate these programs as complex as they are. The minister said she hopes many Canadians who received letter from the Cura will ultimately find out they don't have to repay. She said she feels bad for those who do. We will feel bad. Of course I feel bad, we feel bad, said Cora. Nothing, the CERB program in particular, was designed to help those in horrible, difficult, and uncertain circumstances because of the pandemic. She did suggest the government could find ways to lessen the financial sting of benefit clawback. While the Cura letter advised those who owe money to repay it by December 31st, the agency said that's for tax filing purposes and it's not meant to be a repayment deadline. Delaying repayment could inflate taxpayers' income in 2021 and affect the credits and benefits warrant. The Cura hasn't been collecting on new debits since the pandemic began. The agency has said it will resume collections activities when it's responsible to do so. It's too soon to say when will it be. We don't actually know when we're going to be at a point where it's fair to do this, she said, pointing to the ongoing uncertainty caused by the pandemic. At least one Liberal MP has told the Constitutive about a possibility solution to that CERB income. He said he has been telling people to contact their tax filers to discuss amending their 2019 returns by shifting some eligible expenses to another tax year, or by simply not claiming them. that could boost their declared net income and make them eligible for CERB, he told last week. I let Cassie speak for himself. When asked about the comments on Wednesday, I certainly won't be giving that advice to my constituents. So this is all about the CERB and the repayment of the taxes of the government, right? And it's very important that the CERB was there for us, for the government to repay and to make money out of it. And that's the whole point of the CERB, right? And we all know that the whole CERB is all about, right? Um, so it's very important that we take that very seriously, right? And there's another article I want to be reading before this that. Okay, so Aaron O'Toole walks back claims that residential schools were designed to provide education. NDP Charles Angus said O'Toole engaged is disgraceful race battling to win conservative votes. Conservative leader Aaron O'Toole is walking back comments he made to the university students claiming that residential school system was designated to provide education to indigenous children before it went off the rails and became a horrible program. The very existence of residential schools is a terrible stain of Canada's history that has had sweeping impact on generations of Indigenous Canadians, O'Toole said in a statement released today. I speak about the harm caused by residential school regularly. In my comments, uh, to students, I said that the residential school system was intended to try and provide education. It was not. The system was intended to remove children from the influence of their homes, families, tradition, and culture. O'Toole has been under pressure his statement about the residential schools ever since press programs, a publication institutes, the Global News first reported that the content of Zoom call O'Toole held University Campus Conservative Club earlier this month. In the call, O'Toole addressed what he described as the woke the woke campaign to rename university because of the role the students Nick Sake played in creating the residential school system. The very existence of residential school is a terrible stain on Canada history that has had sweeping impact on generations of Indigenous Canadians. I speak about the harm caused by residential schools. O'Toole said former Prime Minister Pierre Trudeau opened more residential schools than O'Toole said former Prime Minister Pierre Elliott Trudeau opened more residential schools than but did not want try to take Trudeau's name off Montreal Airport. When he was called and people it was meant to try and provide education, he told the students in the call it became a horrible program that really harmed people and we have to learn from that. And I wear orange, but we're not helping anyone by misrepresenting the past. Born in 1803, was an educator minister who was credited with founding the public education system in Ontario. He also played a key role in the creation of the residential school system, prompting some press of the university to change its name. Earlier today, NDP Charles Angus accused O'Toole of engaging in disgraceful revision race, battling to win Conservative vote. We know that there is a pattern among deniers to rewrite the fact that we were found in the Truth and Reconciliation Commission, Angus said. These institutions were not set up to provide education, they were set up to destroy the Indian family. This meant one of the tests of the genocide. A symbol of the First Nation, National Chief Perry took a Twitter to call O'Toole comments reprehensible. It's a disappointment that the Conservative leader Aaron O'Toole to use the residential school tragedy which was devastated generations of the First Nation families to score meaningless political points. He wrote, "No political party can claim the high road on the tragic piece of the Canadian history." So it's really just like always that we know that always the indigenous people they always get discriminated in Canada, and it's just sad that people still don't know the history of the residential schools, and still people calling them names. And Kenny is not only Aaron O'Toole that called them names, but GC Kenny, when he was elected and he was upset before the corona, before all that stuff, he called them names too, and he did the same kind of thing. So I'm saying these people out there, they just don't know the truth. They just don't know when to say things right, and just like today, black people get discriminated. You can see also that indigenous people they get discriminated, and we're living a life um, that we're living a life that's is okay to go and insult people, and it's okay to go and just because they're from different religion or different background or different color. Some people they just see it as okay just to insult them, and it's okay, and it's not okay because uh, we have to respect every race, we have to respect every religion, we have to respect every culture. That's what it is, because that hurts people's feelings. And whatever you say, like as a conservative leader now, he might even lose more votes because that's stupid thing to say, especially if you're planning to run as a prime minister or planning to run as a country leader or whatever. You're going to lose votes because of those kind of comments that you're making, saying that the indigenous people by saying racist comments about them are not admitting about it, right? And and they got abused really badly, right? Imagine if you were there, right? And it was mainly about the education and about everything that they got abused. Right? There was no, they didn't have freedom, right? It's not like now we go to school, they don't force you to do whatever, but they force people, they force them in the religion, they force them in all that stuff, and we know the history of the natives, and that's how they were treated. We're not living in that time now, but what's important is people need to know the history, and they need to know, because people are just arrogant, they just don't know the history and they just assume whatever, and they thinking it's okay by calling them names, by calling them whatever, right? And we have to remember that this is the natives land that we are in. This Canada belongs to the natives. It's not our land. We already enough, we the white people came, and the white man came and took the land from them, right? There's really no apology for that. So if you at least, if they don't have a home now and they have to live in reserves and they have to live in all that stuff, I'm just saying discrimination is not acceptable when it comes to natives, when it comes to blacks, when it comes to any kind of culture. And here, uh, we see a lot of time now. We can even see cops now that are are being racist to the black people by shooting them in their head, by putting their neck, and they uh, and they beat them up. Happened a lot of times, and even Calgary, it will happen with a woman that was there, and they she fell on the ground and she bumped her head, and the police was there, and then they sat her, and then she got injured, and and um and her head was bleeding because the cops was pushing her in the ground, and her head was bleeding, and 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 even police is now, they're not even doing their job anymore. They are looking for people and beating them up, especially the black people is the more majority of it. And it's not just in the US. Like what happened with George Floyd is one example, but police didn't even learn from George Floyd. Even after the George Floyd attack, still people are still police, they don't care, they do it, right? And that Calgary police, I'm shocked that he should be fired because of what he did by stopping somebody's neck and taking them, and it was a prison or whatever, but and took that person, and she was a black lady, and he banged her in the ground, and it was scary to see this, but it's really tragic. And he went to court. He went to court, but the judge didn't see nothing wrong with it. He had to just pay a little bit of fines, but you know what? He got his job back, and now he's working again. And I'm saying like that. Why you just injure somebody and almost you kill them by making them fall on the ground, and now you're giving them the job. This is the world we're living in. Just don't people don't have feelings anymore. That's the problem. And at the same time, that's how I leave it. People just are racist out of nowhere, and they are just not. There's people out there that are good, and there's people out there that are bad. But there's people are being just racist, and it's just they just some the people that hate the blacks and the natives and whatever, right? And we shouldn't be racist no matter what, right? Because at the end of the day, we're all humans, we're all equal, and we should be treated the same. I shouldn't treat one person different than the other person. And majority of these racism are coming from the white people majority of the time, right? You don't see a black person being racist to a white person, or you don't see a native person becoming a racist to a white person. Maybe there is, but those are not that much. When we see it outside, we see more of the white people doing it. I'm not saying the white people are bad. Some of them are good. Some of them they don't. They're not racist. Some of them are not bad, right? I'm not gonna sit there and say all the white people are bad. No, there's some that are out there that are good. But I'm just saying that people just need to know how to um, not allow racism to pass, because George Floyd was a tragic thing, right? This guy didn't do anything, and it has to do with the police, and the police stepped on his neck, and he said, "I couldn't breathe." And we know the history, and we know what happened this summer, and that just happened this summer, I believe, or last summer. So we need to learn from this, and still police they don't learn from this. How many black people after that happened still they get killed because of the police, or they get set in their necks because of the police. And that happens a lot because we have that kind of that's the life of the society we're living in. It's sad to see that people don't want to just be nice to each other, right. Even when I was in elementary, and I used to have friends and whatever, there used to be one kid that was just hating me just because I'm black, and I didn't even do anything to him. So this is the society we're living. These people just whatever you say, they just think some people they just think black people are just stupid. There's some people they see it that way. I know, and I met a lot of black people, and they're smart, and just people are just arrogant, and you just believe that way, and that's not true, right? We're all equal. I cannot say, for example, oh, this one white person, I can see him, he's a loser. No, all white people, there's some white people are good and some white people are not. But I'm not going to be racist and say, okay, and I'll be arrogant and just put every white person down. That's what's happening here. And I'm just saying this is not acceptable. This is not how um, races should be. People need to do better. People need to make sure that they don't be racist to anybody. Like, who are you to be racist to a person or to be rude to a person? Like, everybody deserves respect. Everybody deserves honesty. Everybody deserves the truth. That's life. Who are you to go and to choose that or to do whatever you want? And that's what people are doing. So it's really sad when I'm reading this Aaron O'Toole, and he's a conservative leader for the Conservative Party, and he's saying that kind of stuff. He's no way there's people out there that gonna hate him because of what he's saying. Especially if you're a new leader, and you read this one lady, she said that he needs to step down. He needs to step down as a leader. Like, as a leader, you cannot be racist to residential schools. You know, you can't. As a leader, you can't do that. As a politician, you can't go and just accuse people. You might as well just step down, because you're gonna ruin, actually he's ruining himself, and he's gonna ruin the party. Although maybe the party is not that bad, but maybe he's gonna ruin the party now, and they don't need a leader that's gonna be racist to indigenous, to blacks, to any person. And that's what he did. Although he came out today and he said, "No, I just meant the other way." Does not matter. It's too late. It's viral now. It's on internet. It's on everywhere. Everybody can see what you said. It doesn't matter what you meant it. But if you're running for an election and you say stuff like that, as a leader, especially next election, nobody's gonna vote for you because you are straight up hating. Especially the natives are not gonna vote for you. You're gonna lose a lot of even the blacks, a lot of people. Because nobody likes racist people. And conservatives, the majority of the time, are the racist. That's why I don't like them. That's why I don't choose them ever because they're a party known that people might not agree with me, but I see that's how they are. They're never fair. How many years we had conservatives in Alberta that were didn't care and they were racist, and Jason Kennedy is not surprise to me. We had Jim Prentice, we had Ralph Klein, we had so many uh, uh, premiers in the past that were racist and they were rude. And I'm not a conservative fan, but there's people out there that are conservative fan, and I'm not gonna say I have a problem with that with these people. Everybody can choose what party they're with, but at the end of the day, uh, racist I just don't accept it. That's all that matters, right? Because people should be equal. People shouldn't be racist in any way, right? Who are you to say anything, right? When tragedy happens in the past and history happens in the past, you can't go and be racist about it and make comments like this, like how Aaron O'Toole did, right? These religious school, they lived in hard life, and I feel bad for them, right? I it will be sad if I lived in a time like this, right? And I feel sorry for them, right? I will do anything for the First Nations to help them out if I had that chance. I will do anything to help them out, to do anything I will do because they're good people, and they and even whatever pay with whatever we how much we pay them back is very hard, you know, because we that like like these that white man can mean a lot. Even the government took them years just to apologize for the reconciliation and putting them into schools and forcing them. It took them years just to apologize for that. And we know the history and we know all that, right? So the residential school, their natives, even until today, they have the right to be mad at us because this is their land, first of all. Second of all, uh, they thinking that now, like having a leader like this, Aaron O'Toole, and especially if you're a government or you're a leader and you're being this rude, uh, they're gonna have no respect on you. It doesn't matter what you do, right? And they're just gonna be really disappointed that it's enough that you took the land, you took everything, but no, on top of it, I'm gonna be racist and I'll be rude, and that's what it is at the end of the day. And it's sad when you see a government like that that doesn't even care. Aaron O'Toole, he will never be in power. I'm telling you right now because what he just said today is not even now, but maybe in the past he said a lot of bad comments, but this is the worst of it, saying that this residential school is taken as a joke, right? People were forced, and imagine if you were there and you were had to be abused and be in school. It's not a joke. This is tragic. It's not something to make fun of. It's not something to joke around with. It's not, because this is people's lives that they've been forced. You know, they have to force you in your religion. They have to force you in the culture. Everything was been forced. It was a tragic life in Canada, and that's the history we know. So as a history, we're supposed to respect it. Our history was not supposed to be something that we make fun of it or as a joke of it. It's something did happen, and we have to admit it happened, and we have to respect that. You know, because even the government took like around Harvard government, it took him years just to apologize. Truly apologized when he came to power, but even now the government's giving money and doing all that for the reserves and all that. Even they don't have clean water, and they're upset with the government because they don't have clean water. How many times you hear in the news that the reserves and where they live, they don't have clean water, and the government did not give them clean water. So it's important, like at least we need to help it. Even if we help them out, whatever we do, we have to know that that's not good enough for the First Nations. We need to repay them way more than what they have now, because it's a lot they went through. Like they went through a lot of stuff, and we need to give them huge respect because we were not there. We were not there, so we shouldn't make fun of them. We shouldn't joke around with them. This is history. We need to respect history. That's what's really important. And today's comments is not respectable comments. Is the worst comment I heard from Aaron O'Toole. Besides, I don't even see Aaron O'Toole is a good leader, and I don't see him. He's well known, right? Although he apologized for it today, but it's too late. Like once you say something, it does not matter. People are never gonna forget what you say. It does not matter if he joked around with it, or he took it as a joke, or he didn't take it as a serious. People are never gonna forget. So So it's how much you take it seriously. That's what really matters, and that's what this government did not take nothing seriously, and that's what happened. So so hopefully these kind of things people know about it, and not joke around with it, because I'm being serious here, that is very important that people do what they can and make sure that they follow the health rules and don't take it just as a joke, because nothing should be as a joke. Everything should be serious. Everything should be livable. That's how important these kind of things are. 'Cause people just don't understand when I should say things or when I should not say things. And there's some things that you should say, and there's some things that you should not say. And there's good times and bad times, but you have to know when's the good time to say something and when is the bad time for me to say something. I don't go just say the things that I just want to say and hurt people's feelings and put them down in a way that they shouldn't. Because at the end of the day, there's respect here for everybody, right? Everybody deserves respect. We deserve respect. Everybody. If we want people to respect us, we at least have to respect people's too. We need to respect them, respect their lives, respect everything, the livelihood. Everything needs to be respected. It's not we do what we want at the end of the day and joke around with it and does not matter, and who cares? Some people, they just do that. They just rather um, joke around with people's lives and does not matter to them, and they don't take it seriously, and they think it's a joke, and it's not a joke. Nothing in life we should take it as a joke, or nothing. We should take everything in life very seriously as much as we can. That's all I'm saying. So it's very important. It's simple. Follow health rules and follow the health guidelines, and to do what you can, because some people, they don't see that that's important, and that should be really important. Because some people, they just see, oh, people's life don't matter. People's life can do whatever they want at the end of the day and let it pass at the end of the day, and it isn't, right? So we need to make sure as much as we can by doing what's right, by protecting our health, by following the health guidelines. That's what's really important. That's what I expect everybody to do, because it's not a hard thing to do. Seriously, not hard. But some people, they take it very difficult and take it very overwhelming, and it isn't. Nothing should be overwhelming, and nothing should be hard. Everything is easy, but we need to just know our limits here, right? That's what's really important. That's why I'm talking about this, because some people just don't know their limits at the end of the day, and that's the problem. When you don't know your limits, it's a big issue. So that's what I expect everybody to do, and it does not matter what, but follow the health guidelines, follow everything, and and uh, and do what you can, because um, this is life at the end of the day. This is not a joke or joking matter. This I'm talking about really seriously. So please do what you can, and protect yourself, and making sure that you follow the health rules. Don't joke around with the health at all, because you just have one body at the end of the day, and that's what matters, right? Anyways, I will be talking about now. I'm gonna go to the news, because Jason Kenny, he's gonna be announcing not Jason Kenny, but there will be an update for Alberta soon. So I'm gonna be going there and talking and seeing it, right? Discuss it too while it's live, because we're gonna be live in 6 minutes, right? And it's very important that take these kind of things seriously, right? And I already talked about the restrictions, and it's very important that people take the restrictions very seriously. The restrictions are going to be put in place today, so just make sure that you be here. Make sure that you take it seriously, because those restrictions I'm not lifting up for these couple of days, right? So just know that these restrictions will go. So hopefully everybody understands what exactly I'm talking about, um, because I'm not joking around with this. I'm being serious that that's what Aaron included to himself, and nobody told him to do this. But I'm saying health and priority is really important. To make sure you follow the health rules and follow the health guidelines is really important, right? And not joke around with these kind of things, because some people, they just joke around with this, and I don't want anybody to really joke around with their health at all. So um, do what you can as much as you can. follow the health rules, do what you need to do because it's really important. And please think about what I'm talking about, because what I'm talking about is the fact that we get discriminated every day like crazy, and that needs to stop, right? So um, it doesn't matter what happens, but things need to be way better than this. That's all I'm saying. So if anybody has questions, right? Anybody has questions, can write it in the chat. Or because I can answer you during the chat if you have any questions about anything. Um, so um, and we moving on now, talking about um, so I will be talking about a lot of stuff. So it's very important that people follow the rules and follow the health guidelines as much as they can. If anybody has any questions, I'm done. I talked to because I'm talking about a lot of about things that people need to really understand. Some things people know, some people things people do not know, and it's very important that some of these things people should know about them and take them seriously um, in every way. Is there any questions that has to do with with the COVID or COVID-19 or anything that I just talked about right now, right? So yes, restrictions are going to be effective today, and make sure that you follow the health rules, you follow the health guidelines as much as you can, because like I said, numbers are still rising in Alberta, and like I said, COVID is not good, not gone yet. So we need to make sure that we you have to make sure that we protect our health until the COVID leaves for good, right? Because this will take a time for it to leave. It won't just leave this fast, right? So we need to be patient a little bit for it to leave, and that will happen, right? It's not something that just going to leave like this and that's it, right? It's something that's going to take a lot of time. So we need to be serious about it as much as we can, and that's what we need to do. And during the break, just try not to go out much. Um, because it's just not safe, right? Like I said, this Christmas it will be different for everybody, but again, it's very important that your health and your safety is really important than anything. Because some people they just don't understand uh, what's the worst, what's the best about it, right? And so I'm gonna be reading here the numbers, more numbers of COVID. So more than 9 months into the worst pandemic in the century, Alberta has learned a lot about COVID-19. One-day basis, people study the statistics, new cases, active cases, hospitalization, test numbers, outbreaks in schools, even something called the re-value and the saddest number of all deaths. So here where things sat as of Tuesday when the province reported. So Alberta reported 1,341 new cases, 20,649 active cases, 742 people in hospital, including 137 in ICU, 16,353 tests, a total of 1,581, 863 people tested, a positive rate of 8.2%, 162 schools on alert, with 270 total cases. 294 schools with outbreak, with 1,673 total cases, 11 more deaths for the total of 744. So the province RV value from December 7th to the 13th, 0.98. Edmonton zone minus 100. Calgary minus 0.29. And rest of Alberta is 1.01. On Wednesday, Dr. Dina Hinshaw, the province chief medical health officer, will provide an update on news conference scheduled at 3:30 p.m. So these are the numbers that I was just talking about. Because it's very important that everybody knows that. So it's very important that so Alberta public health officials have 3 days to figure out how they will inform students and staff exposed to COVID-19 in school once the building shut down for the holidays. Um, Both Edmonton Public School and Catholic School divisions say their staff will be on holiday break after Friday. Edmonton Catholic School sent families a letter saying employees would not be calling up students and staff after Friday if they'd been in contact with someone who tested positive. Edmonton Public School will get in touch with any close contact they're aware of until the end of the day on December the 23rd. Both divisions want people who test positive for COVID-19 to notify schools by email during the 2 week break. Dr. Dina Hinshaw, Alberta Chief Medical Health Officer of Health, said Tuesday that the public health workers also lack access to any class list while schools are shut for the break. Alberta Health is exploring its options, Hinshaw said. There's a solution working on and do not have a firm answer at this time, but it is under discussion, she said. She did not directly answer whether Alberta has enough contact tracers working during the holidays to notify people when may have been exposed. No budget limited on hiring tracers, Premier says. Although Alberta sorry everybody, no budget limit on higher tracers, Premier says. Although Alberta Health Services AHS is working to increase the number of workers tracing the close contact of people who test positive for COVID-19. Some symptoms students have spent 14 days in isolation and were back at school before AHS confirmed they had a disease. Growing lag time promoting principals to rely on families' calls to the school about positive tests rather than waiting on words from AHS. Although AHS has about 700 contact tracers by September, it wasn't enough to keep up with a November explosion of cases. AHS spokesperson Kerry Wilson said there are now 1,100 tracers working and organization is on track to have 1,600 employed by the end of December. Premier Jason Kenney said at a news conference Tuesday it has been a challenge for AHS to find people trained as healthcare workers to fill some of the roles. There are not all jobs that just regular lay people can step into and get soft touch training, he said. Our direction as the cabinet committee has been not to let perfect to be the enemy of the good. And just to try to train up people with some relevant capacity as quick as they could. The government also asked for part-time tracers to work full-time hours where possible, although the United Conservative Party government has been firm that it intends to curtail the cost of the health system in time. Kenny said the government has stopped capped AHS contact tracing budget. They should go as hard and fast as they possible could to hire more people and train them up was the direction from the government, he said. Kenny said at least count 32, four, four WestJet employees, including a pilot, were working temporarily as tracers. He said he expects the province should have enough tracers to keep up with the newly identified cases sometime within the first 3 months of 2021. The contact tracers identify people who may have been in close contact with a person who tests positive for COVID-19. They reach out to those contacts and advise them to isolate and monitor themselves for symptoms to help prevent the spread of potential fatal coronavirus. So these are the schools that the government announced. So, when the University of Alberta Hospital respiratory therapist got the call to book her appointment, she was just excited about being among the first wave of the province health care workers to receive the Pfizer BioNTech vaccine. It was a complete surprise to learn that she'd also be the first not just in Edmonton but in the province. I wasn't waking up yesterday morning thinking that I was going to be doing interviews. I'll tell you that told CBC Radio Edmonton AM on Wednesday. Alberta vaccination rollout got underway in both Calgary and Edmonton on Tuesday after a cargo plane delivered 3,900 doses of vaccine late Monday. Another 25,000 Pfizer doses are expected to arrive next week, and doses of Moderna vaccine should arrive before the end of December. People assume that as healthcare workers we're just so used to seeing death, but the reality is that on an average week in the hospital, they would probably be about 1 to 3 deaths, and it does impact you each time, she said. However, the amount of deaths that are being seen far exceeded that of the usual, the normal, and it's really starting to impact the mental health of a lot of my colleagues. A recovery ward nurse at the hospital of U of A Hospital is also on the list to get the vaccine. It feels like the light at the end of the tunnel, a very long, dark tunnel, she told Edmonton AM on Wednesday. People are excited and anxious to hear about when they will be next, including me. The recent in COVID-19 hospitalization has been incredibly stressful, worstful, she said. 36 hours later, it's filled. In the spring recovery ward were quiet after all non-essential surgeries were cancelled in absences of surgery in cases that did not materialize until now, she said. We opened a unit to have COVID-19 patients admitted to on Friday, and 36 hours later it's filled, she said. Both nurses stressed the importance of understanding exactly what the vaccine will and will not do. You can't stop wearing your mask or stop washing your hands or social distancing while the vaccine is rolling out, she said. Until we're told that the greater numbers of people have been vaccinated and that we have crushed that curve, you must maintain the restrictions that are put out right now. He also noted that the vaccine is not a cure and echoed comments that health precautions still need to be followed. The vaccine is definitely making me feel a lot more comfortable that should I contact it, I'll be able to fight it much easier and it'll kind of be just a much smaller thing than it normally would have, she said. However, we have to remember that it's not a cure that's just going to make this virus go away. And that's true. This is just going to make the virus go away. It's not a cure. It's not going to do much. The only thing it's going to do is only to make the virus go away. And she has a point when it comes to that kind of thing. Hope everybody have a great day and see you tomorrow. Yeah.